You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Kaylee Delishmitt, BHC Pharmacy Program Coordinator.
Hello, I'm Kaylee Delishmitt, and welcome to this episode of the BHC's Be Health Connected podcast. In 2002, employers called upon the St. Louis Area Business Health Coalition to provide a pharmacy benefit group purchasing solution to provide transparency, accountability, and best-in-class pricing. Delivering health services in the St. Louis area for over 30 years, Express Scripts has been a longstanding PBM partner of our pharmacy management initiative since its inception. The pharmacy benefit is the single most utilized benefit among employer plans, and today we are joined by Harold Carter, Chief Pharma Trade Relations Officer for Express Scripts, to discuss how the organization is unlocking new value for clients and customers through innovative solutions. Thanks so much for joining us today, Harold.
Thanks for having me. Happy to be on.
So we'll jump right in with our first question, being what do you see as the biggest opportunities and challenges in the pharmacy landscape this year?
Yeah, one of the biggest opportunities I think exist is certainly going to be biosimilars, right? We've been talking about those for a while. Express has had a long-standing advocacy arm of our organization in the federal level to help bring biosimilars to the marketplace. The good part, right, is we have some experience with biosimilars up to this point, whether you look at Semglee or you look at a lot of the biosimilars that came to the marketplace over the last few years on the medical benefit side. There's finally one biosimilar here, Amjevita, and there will be a number of additional biosimilars for Humira later this year. Mid-year later this year, as well as potentially some biosimilars to Stelara. So a fantastic time where we're able to leverage that competition to really bring down cost in a class that historically has always been at the top of all of everyone's list of drug spend. That's certainly a great opportunity. The other piece too is as we look through it, there truly is growing innovative treatments that are coming into the marketplace. We're going to see some additional gene therapy products, some additional cell therapy products that will come to the market here later on. And as much as those are significant opportunities for patients, for the market at large, those also represent challenges, right? So as we think about these new innovative, treatments, they come at pretty large price tags. And so we've got to really make sure that we're looking at ways to provide predictability there for plan sponsors, but also members, right? That they can get access to that. So a lot of great opportunities, but challenges in finding how to balance that. The last thing I would say on the challenge front is, there's a lot going on from a regulatory perspective, whether it's in our state here, Missouri, other states, but just as important at the federal level, there's a tremendous amount of things going on. And when that happens, it leads to a lot of unknown sort of events. And so it's going to be probably a bit fluid for a while. And so it's really an area to sort of keep a close eye on. We certainly will be working with all of you to keep a close eye on that and understand what that means to you and the benefits that you provide to your members day in and day out.
Our next question has to do a little bit with your previous response. Actually, you mentioned that Express Scripts has an advocacy arm and is working with the BHC and with employers to increase or be aware of biosimilars and gene therapies. So I was wondering if you could elaborate on how Express Scripts is supporting employers in managing rising pharmacy costs, especially as it pertains to those specialty medications, gene therapies, and biosimilars.
Yeah, so there's no silver bullet that solves everything, but we take a multi-prong approach. If we use biosimilars for an example, Dr. Steve Miller, who used to be our chief medical officer, as well as our government affairs team, spent years in the early 2000s advocating at the federal level for creating a pathway for biosimilars to come to the marketplace and then subsequently for interchangeability. So this has been an area that the company has been focused on for more than a decade. And the fruits of that labor, obviously working in partnership with, the St. Louis Business Health Coalition and others, has come to fruition, right, as we're starting to see treatments come to the marketplace. But that, right, there's still a lot of work to do there, but has come a long way since then. When I think about it, though, it fits into a few different buckets. First and foremost is to educate, to seek to understand and educate. And the way that you're able to do this is understanding what are the dynamics, what are the treatment options that are coming to it, what do all those biosimilars look like, and then how do we help to inform our plan sponsors on what's coming down the road so they can prepare for it. But also, just as importantly, how are we educating and talking to providers? Because there's such a very important part of the mix to all of this as they're working with patients day in and day out. How do we educate the pharmacies so they understand the value of these and that they're clinically as safe? And then how do we work with members? And so it really is, in that first step is really kind of taking that education piece and going from there. The second piece that I would think about is then, okay, so now how do we leverage some of the tools that exist in the arsenal today, whether that's as well as formulary, to ensure that everyone is seeing that value come to fruition. But how are we evolving those solutions as well, right? So that they're smoother, they're more succinct, things of that nature. And then on top of that, how do we evolve even further? So if you think about just in the past, not too far away, is that we rolled out Embark, focusing particularly on gene therapy, where we're providing, predictability at that 99 cents PMPM, where there's predictability for the plan sponsor, but also the member, as well as if there's any sort of dollars left over in that program, that it gets sort of paid out at the end of the year if it's not used. And so we're able to do some very unique things there. And that's really setting the stage for not just the gene therapy products that recently came to the marketplace, but the ones in front of us that we know specifically are going to have much larger populations and coming at much higher price points potentially. And so again, it's not just understanding and educating, but it's then how do you leverage the existing tools that everyone's used to and then building upon on top of that. And those are things that you've seen us do over the last few years. And that's not going to stop, particularly as we start thinking about rare diseases, we start looking at oncology. The mindset will be, how do we continue to evolve those our tools, but also enhance some of those supports, particularly so that we're putting the patient at the center of it, because we know that when we're successful there, we can improve outcomes, we can lower costs for plan sponsors, and make sure that we're helping create a much healthier workforce for ourselves.
What I think I'm hearing is that there's a lot of expansion around drug offering, prescription drugs, and drug therapies. But what about beyond the traditional prescription drug offering? How is the pharmacy benefit expanding to be a more holistic benefit in general?
Yeah, so there's a few pieces to think about there, right? When we think, when I'll give you a great example, is so much. If you look at a class such as oncology, oftentimes folks think about it in a realm of medical benefit versus pharmacy benefit, versus looking at oncology treatment at its heart, and how do we help those patients through that journey, and how do we connect the dots for them along the way and shelter them through the entire pathway. And so as you think about, I would say, the benefit going forward, sometimes there's that folks shouldn't always think about pharmacy versus medical, but what are we doing to sort of support those patients and manage the costs that's associated with it, or the waste that's associated through their patient journey, because that's what's the best, that's going to lead to better outcomes and better costs for everyone. And so as we think about evolution, I think that's going to be a key piece. The other piece that I would say is to think about as well is, we oftentimes talk about thinking about how do we get patients adherent, but oftentimes we forget that there's a lot of factors outside of just the drug itself that drive a patient's adherence and drive their outcomes, right? We know that 80% are impacted by social determinants of health outside of just the healthcare setting. So whether that's transportation, that's housing, that's socioeconomic status. And so when we think about it, it's really about how do we infuse, such as our social determinants of health index that Evernorth has, how do we infuse that into everything that we do? So it's not just the what you've seen historically, but how do we make sure that we're targeting and engaging with patients where they are, and making sure that they have the tools that are necessary that allow them to actually be successful, to not only get access to care, but get continuous access to care, respond to it, and engage and get the support that they need on their own specific journey. And so when we think about healthcare going forward, it's not just the drug or the disease, but But we know that there's other barriers, particularly that exist in various communities, not just in St. Louis, but when we think nationally, what are some things that we can do more effectively there on a go forward basis? So that is a large part that the organization has made an investment in, and an area that we'll continue to expand in.
I love it. As somebody with a public health background, I really enjoy hearing the social determinants of health being integrated into the pharmacy benefit space. It's really exciting stuff. If you don't mind, we're going to shift gears entirely.
All right,
we've
let's do it.
Yeah, we've seen a lot of consolidation in the marketplace, right? And so my question for you is, how do you see vertical integration and the consolidation of health plans, PBMs, and care providers impacting pharmacy benefits as members experience them today?
Yeah, it's a great question. There's a lot of different models that are out there that exist today, and so certainly Express Scripts was purchased by Cigna at the end of 2018. The way that I see it, though, is a few different things. One, as you mentioned before, the pharmacy benefit is the most utilized benefit that's there. It's the first entry point that doesn't always give you all the answers, but gives you early signs that something right isn't going on, and allows us to engage. And so when I think about it from our organization's perspective, in the structure that we've taken and what we've gone through creating our health services organization as Evernorth, there are certainly pieces of the puzzle that we have internally or we have partnerships with that we can do. But we actually think that a lot of sort of the acquisitions movements that happen actually are still going to require a significant amount of partnership around the healthcare system. And so a lot of those, whether it's a health plan that a plan sponsor uses, whether it's a point solution that they use, there's a significant amount of partnership that's still going to have to happen across the healthcare system. And we're structured in a way under Evernorth to uniquely do that, whether it's with the providers, it's with the pharmacies, it's with tech companies, et cetera. And you've seen that resonate pretty well across the market with some of the partnerships that we've been able to announce, whether that is a new plan sponsor, whether it's a health plan, et cetera. And so that model has resonated. And when I think on a go forward basis, I don't think that there's going to be a scenario where everything's in-house for any organization. The ones that are going to do the best are going to be the ones that can partner across the healthcare system to make treatments and outcomes improve for patients and manage cost.
I couldn't agree more. You know, that care coordination piece is absolutely essential when we have all these players involved, right?
Yeah.
And earlier you mentioned legislation and how you almost alluded to the fact that it could potentially be a challenge. So how are some of the state and federal legislation that's being proposed going to impact how employers manage their benefit?
Yeah. So as you look at whether it's in certain states as well as the federal level, you're seeing a tremendous amount of conversations around copay or required co-payments on insulin and some of those things. It's even happening at the federal level. That impacts the flexibility or the optionality that plan sponsors have on how they want to run their benefit, right? You're seeing different things around copay programs, structures being taken. So there's all of these. You see IRA that's coming, and the question is, while it's focused on the Medicare side, what does that mean to the commercial side of the business of the market, right? And so no one really knows how some of these things are going to sort of where they're going to land or what the long-term impact is, because there's still details that are coming out. But one of the things that we focus on is how do we make sure that we are advocating on the behalf of those that we serve, whether that's members, it's plan sponsors, to make sure that they continue to have the optionality in the marketplace that they feel best meets the needs of their members, their employees, and the constituents that they're serving. And I'll go ahead and do this shamelessly. I'll put out just a plug on to visit What's Possible. And so this is actually it's our healthcare advocacy website. And that's to learn about what's going on in health policy, how clients can make their voices heard on various policy debates, information, things of that nature. And so we created this not too long ago to be a source that all of our clients could actually go and understand what's going on, whether it's at the state level and the state's certainly Missouri, which we're aware of, but you have so many more that service just outside of Missouri, but also then at a federal level. So just put a plug in for that, where we keep real time information. We provide ways for you to give us feedback to make sure that we're addressing what you're thinking or what you want to be heard in those various states side by side with you. So something to just take a look at.
It sounds like a great resource, and it's important for, it's important for employers to know that it's out there, because the legislation and policy space is rapidly changing and ever
Changing daily.
evolving. And there's so much focus being placed on the pharmacy benefit in particular these days. So it sounds like it's a great place for employers to start, so they can get some of those initial questions answered.
Yeah, and to the extent that they have additional questions, myself as well as our government affairs team, we have a small but mighty team that's there that focuses on the state as well as the federal level, and are sort of ready to sort of sit arm in arm with you as well as your account team to sort of dive into more details. So certainly reach out, take a look. If you have questions, don't hesitate to reach out, and we're happy to jump in.
Well, I think our last question is an opportunity to further elaborate on some of the stuff we were talking about earlier, the expansions of the pharmacy benefit and pharmaceutical innovations in a way that provide better care for patients with diverse backgrounds and needs. So I was wondering if you could give us a little bit more information, maybe on how Express Scripts and Evernorth are leveraging that index you mentioned earlier to bring care to the patient, like you were mentioning.
Yeah, so a great example. So a few different things. And one of the interesting things we just recently did around our social determinants indexes, we actually noticed that there were certain communities with one of our plan sponsors where patients were struggling, particularly with prenatal treatment, things of that nature, vitamins. And so we were actually able to sort of identify that within the index and actually put some resources there in that community to help, because we know that unfortunately in certain communities that the mortality rate for kiddos and newborns is lower. So that's a great example where we were able to make some pretty quick investments there. We actually also look at there's certain areas in the country, right, where we actually see a larger perspective or prevalence of cardio disease, right? And how are we ensuring that, one, those patients are getting tested, but two, there are treatments that they can be taking that are costing pennies a day that could stave off significant, worse outcomes later on, heart disease, heart attacks, hospitalization, early death, things of that nature. So there's just so many ways that we can sort of take investments there and make sure that those folks are having tools. The other thing too is, while there's a lot of conversation, I know particularly around diverse backgrounds, we're also seeing a dynamic that's happening around treatments that are out in the marketplace today. Certainly we're seeing, as we're coming out of some of the throes of COVID, I guess it's here to stay, or however we frame that up, is we're seeing a lot. We're seeing, worse diabetes coming out as folks are going to the doctor's office. We're certainly seeing some later stages at times of cancer treatment. We're seeing a proliferation, obviously, of folks going to weight loss drugs, things of that nature. And so as we think about the market, we think that the benefits, there's probably some things to be thinking about long-term around what do some of the benefits look like long-term. And what I mean by that is there's ways that we actually have to go about treating patients today, making sure they're successful on treatment. But now it's really time to get, I think, a lot more serious on the wellness side. On some of these things are actually preventable. And we talk about this year after year after year, but we still see a large wave of patients, unfortunately, developing diabetes, right? We see a large wave of patients that aren't getting the screenings up front that could have prevented either later stage cancer or cancer at all, or catching it early so their prognosis looked better. And so I think one of the areas that we've got to make really better strides at, and it's going to be community by community, state by state, is how do we get so much better at early screening, removing some of the stigmas that's associated with screening. I know within certain communities, right, there's folks have a concern around healthcare, right? And and maybe aren't either understanding everything or have, for various legitimate reasons, have a concern around the healthcare system. And as they get involved, what does that mean? And so I think there's a lot of things that we can do, particularly even in the St. Louis community, to really step it up. And it's going to be on all of us, right? It's going to be on Express Scripts. It's going to be on Evernorth. This is the area that many of us live, work, and play in. And a lot of the employees that are part of the St. Louis Business Health Coalition. So I think there's still quite a bit of work to do there. I can't sit here and tell you that we have the exact answer or the proverbial silver bullet. But if we really want to sort of address some of these things, it's about getting out. It's about getting out ahead of it. We can't continue to just treat right chronic. And we're seeing that with gene therapy, right? That some of it is potentially curative or potentially one-time treatments. We've got to kind of change the script on that a little bit. So we'll see what comes there, but that's also a big focus.
I think you bring up a great point. Having all of these innovative drug therapies are a great resource, but we have to get to the source of the problem,
Yep.
preventing the issues before they occur. Well, I think that wraps up our questions. So we just want to say thanks again for joining us today. We really appreciate your longtime partnership and commitment to delivering the best value for our pharmacy management initiative. As we close out today's episode, do you have any parting words for our audience?
Yeah, for any of those of you, I'll put in a plug. We obviously have our outcomes here coming shortly. Be on the lookout for that. There's going to be some great topics. Going to hit on some of the items that I just talked about. Certainly something that's on everyone's line is what's going to happen with weight loss, what's going to happen with diabetes, what are some of the steps that are being taken there. So just look forward to seeing all of you all in sunny Florida. If you have the opportunity to come out, and look forward for all those great conversations.
Sounds great. Well, we look forward to seeing you at Outcomes later this month as well. And thanks again for your time today. We'll talk soon.
Thanks. Bye.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.